This is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Today I wanted to talk to you about a root canal therapy. It's a procedure that's done to save the tooth when the tooth is in pain, the nerves become inflamed or infected. There are a number of reasons a tooth might need a root canal, but most typically it's due to a deep decay or a history of deep decay. Some signs or symptoms that you might need a root canal include pain in the tooth, especially prolonged sensitivity to cold, heat on occasion, but more frequently cold. Also, if you've had a history of trauma on the tooth and over time the tooth becomes discolored. And finally, if you have infection in the tooth, it goes outside of the tooth and you get swelling in the gum. So if you have a swelling or an abscess or pain in the gum, that would also be an indication for a root canal or an extraction. Once it gets to this point, your options are to extract the tooth, in which case we can do an dental implant, or we can save the tooth with a root canal. So the tooths become inflamed or infected. You're seeing here the little abscess at the root of the tooth. Most of my patients who get a root canal say it's not as bad as they were expecting. It starts and ends the same as a crown or a filling. We get you numb, we clean out the decay. The only part of the root canal that's an extra step is we just clean out the nerve tissue with some little files, and then we fill it with a natural rubber material. Root canals get a bad reputation from years, decades ago, when we had to hand file out the whole tooth. It took a long time. People had waited until the tooth had become inflamed and infected, or it was hard to get numb. I never work on a patient unless there's profound anesthesia. And then the hole that we accessed to the nerve chamber is filled with a filling, and then a crown goes over that. The rest of the procedure, other than just cleaning out the nerve tissue and filling it with a natural rubber, is exactly the same as a crown or a filling. So it's going to be pain-free. It's going to take as few as 10 minutes, maybe up to an hour for a really complicated back molar. It's quick, easy, painless procedure that removes the inflamed or infected tissue out of the tooth.